Hello, I'm Dr. Michael Kotsy, and I'm an orthopedic surgeon here at Evergreen Hospital in Kirkland, Washington. And I want to talk to you about shoulder arthritis. And the first thing I want to talk about is what is shoulder arthritis. So if we look at these two x-rays here, I think we can get a good idea of the difference between a normal shoulder, which is here, and an abnormal shoulder, one that has arthritis. So the first thing to see here is, see this ball? This is the ball of your shoulder joint. Down here is your arm bone, and here is your shoulder blade. And this is the cup right here of your shoulder. And if you look closely here, this ball right here is nice and round. It looks smooth. There's no irregularity. There's no little bumps. And there's a space between the ball and the cup here. And that space is made of cartilage. And cartilage is the smooth stuff on the end of your bones. And that is what allows your joints to move nice and smoothly. And cartilage is 6 times as smooth as ice on ice. So it's very, very smooth tissue. But when that tissue wears away and it exposes the bone, which is underneath here, bone is very rough, and when bone touches bone, that's when you get arthritis. So on this picture here, you can see that the ball is not smooth anymore. You see these little bumps right here, and then it's round, and then you see this big bump right here. This right here is a spur from arthritis. Sometimes these spurs can get really big. They can come all the way down to here. And all of these spurs are inside the joint. So you can imagine if you've got some covering that goes around the joint and you pack it with all these bone spurs, this ball is not going to move very well. You're going to become stiff. So a lot of patients with bad arthritis lose motion in their shoulder. They can't reach behind their back, they can't reach above their head like they used to, and they can't reach out to the side like when you're trying to grab something from McDonald's drive-thru. So, arthritis is a disease of the cartilage. It is when the bone is exposed on the end of the ball and on the cup. And there's many different levels of arthritis. So you can have really mild arthritis, where there might be just a little bit of loss of the cartilage in one little spot. Or you can get severe arthritis, where the whole ball is completely bare and just bone touching bone. Okay? So let's talk a little bit about what your treatment options are for this arthritis here. So the first thing is the basic pain medicines that you get at any pharmacy. Any kind of anti-inflammatories can help relieve your pain. And these are things like Advil, inflammatories. So you have Advil, you have Aleve, and then another category, you have Tylenol. And surprisingly, these give pretty good relief when you have mild arthritis. And most people can get by with taking this maybe before they go to sleep at night or one during the day, and you're good to go. Other medicines that you can take are things that are a little stronger, such as narcotics, but most of the time you only take those if you have very severe arthritis and you don't have any other treatment options. So really narcotics are really something that you should avoid, because you can become tolerant to those and they do have side effects. So what happens when you take an occasional Advil and you still have pain from your arthritis? What can you do? Another thing you could try are supplements. And supplements are natural remedies, and you might have heard of a few, like glucosamine, and chondroitin sulfate is another one. These are things you find at any health food store, and what they are meant to do is try and replace. These are the building blocks of cartilage in your joint, and the thought is if you take more of these building blocks, you're more likely to replenish the cartilage that's in the joint here. And they work probably for about half the patients that take them, and they are there's really no risk to taking these, and the only risk is actually to your pocketbook, because sometimes they are costly. And what I recommend is just going to a website called arthritis.org, and they have a whole supplement guide there, and it will talk to you about all the different supplements that are out there. There's studies on these supplements, and they can tell you which ones might be best for you to try. Now, when these things don't work, other simple remedies such as ice, or more commonly heating pad on the shoulder before you go to sleep at night can often help. And that's usually the one that I recommend for someone who has a little trouble sleeping, is get a little heating pad. That'll help you out. Activity modification is always the other thing. Sometimes when you get older, there's certain things that you can't doing the heavy lifting up overhead or doing heavy weightlifting. Sometimes you might have to moderate that a little bit. And then another thing that you can try here are injections. Now, injections are steroids, and sometimes you can take these injections and you inject them right in the joint here, and what they can do is decrease some of the inflammation that's in this joint that causes pain. The upside is sometimes they give pretty good relief. The downside is most of the time they're only temporary. So it's a temporary solution, and I usually say if you've got some big event that you need to go to and enjoy, like a wedding, or you're going on a big vacation, there's nothing wrong with trying an injection before then. But for long-term cure, this is not really the answer. So if you've tried all these things and you still have really significant pain, especially if you have pain at night, there is a surgical solution that could help you, and that is a joint replacement. And a joint replacement is where we put on a new ball and a new cup. So you replace this ball with a metal ball right here, like this, and that metal ball is attached to something that goes down the arm bone here to secure it in place. And then we put a piece of plastic on the other side here, and that piece of plastic has these little tubes in here and little spikes in there, and that basically is held inside the bone here. So now you get a nice smooth surface. Not quite ice on ice, but pretty darn smooth, and it really does the job of allowing people to get good pain relief. And so a joint replacement is excellent at relieving pain. It is sometimes good at improving your motion, but not as reliable for pain relief. So really the main reason to do this is for pain relief, and most people who have, let's say, an 8 out of 10 pain, they go to about a 2 out of 10. So, or if you can say, people beforehand can only do maybe 50% of their activities without pain, they usually go to doing 75% of their activities without pain. It's not 100%. A couple people can get really great normal function, but most people, you get about 75% of your activities back that you like to do. So it doesn't make you 18 again, but it can certainly make you feel a lot better, especially if you can't sleep at night because you just have this constant pain in your shoulder. Now, if you have arthritis, the best thing to do is to see your healthcare provider, because they can make the diagnosis by getting an x-ray of your shoulder. And if you do have arthritis like this with significant pain, you need to see your surgeon so you can talk about what your options are and whether you really truly are a candidate for surgery, or if it's best to start with those other options that I just talked about earlier.